Malaria is one of those illnesses we hear about so often that many of us think we already understand it. But what exactly is malaria? Why is it still so common? And with all the treatment and prevention campaigns out there, why does it continue to affect millions of people every year? Well, hello and welcome to today's episode of Untangle. Today, we slow everything down and we take a closer look at the disease. My name is Blessing Dagin. Thank you for coming to learn. Well, helping us unpack all of this today is Dr. Ahmad Sani Bala, a resident family physician, a public health advocate, and founder and CEO of Vital Aid Medical Foundation. He has both medical and community experience to bring clarity to this topic today. It's a big pleasure to have you join us, Doctor.
Pleasure is all mine, Blessing. Thank you for having me.
All right. So we're here to talk about malaria. I mean, we need to actually take a closer look at malaria because a lot of people know what malaria is, especially in this part of the world, but then we just know it as a part of our lives. So help us break it down from the very beginning. What is malaria? How does it work? How does it affect the body?
Thank you very much. As you said, we have internalized and accepted malaria as part of our life, which is, we are in a malaria endemic region. That's the truth. But efforts are being put in place to change the narrative.
Yeah.
So malaria, it's a disease that is caused by a parasite. That's the Plasmodium parasite. So there's this often misconception that mosquitoes cause malaria.
Okay.
But mosquitoes are the vectors that transmit what causes the malaria. So malaria, as I said earlier, is a disease that is caused by the parasite, Plasmodium parasite.
Okay.
So that's the causative agent, is a parasite that infects the body to cause malaria.
Okay.
And we have different types of this parasite. We have Plasmodium falciparum, we have Ovale, we have Malaria, we have Vivax. There are different classes of that particular parasite that causes malaria.
Okay.
So the infection of malaria in the human body happens when a mosquito, that's not every mosquito, a particular type of mosquito, that's the female Anopheles mosquito, which we have them in abundance here in our environment. So when this mosquito now transmits that when during a blood meal, or what we consider mosquito bite. Okay. So when it bites somebody, it transmits those parasites, either of the parasites I mentioned earlier on, that's the Plasmodium parasite, into the human body. Okay. So the infection happens now when these parasites migrate from the bloodstream directly to the liver, where they silently multiply, and then they are released subsequently into the bloodstream, affecting the red blood cells. So once that happens, the symptoms of malaria set in, and then a person comes down with malaria.
Oh, interesting.
Yes.
Thank you for that very beautiful
You're
breakdown.
welcome.
But then, especially since malaria is something we often talk about because we know malaria, like fever, chills. Are there particular symptoms that, a person comes down with that we often ignore that should actually point down to malaria, but we often ignore?
Yes. So clinically, we manage this holistically, right?
Yeah.
When the patient comes, there is what the patient comes to complain with. These are the symptoms. Yeah. And then there is what you as a physician or doctor, you elicit. And then the laboratory component or other investigative components to tidy up and say, this is what. So yes, definitely from the history, we have classical symptoms that the patient would tell you. As like you mentioned earlier on, the pattern of the fever. You mentioned chills and rigors, which is classic of fever from malaria. And then patient would complain of hotness of the body, loss of appetite, generalized body weakness, nausea, vomiting, depending on the severity of the malaria, because we have from mild to severe malaria, complicated and uncomplicated malaria. So depending on the type of malaria, the symptom and then the investigation findings also would let you know. But the common symptoms that people tend to present more with in our environment in uncomplicated malaria, fever, they will stay in the with chills, like they will be having coldness, and then they will be having like shivering. We call it chills and rigors.
Okay.
Then morning and fever will be worse in the evenings. Evening time, patient has to cover him or herself. And then loss of appetite. We have joint pains, generalized body weakness, and then headaches also.
Okay.
Yes.
All right. So from the beginning, you mentioned the classes of parasites.
Yes.
That cause malaria. Is it parasite now, or I don't know the term exactly. So you mentioned the different types.
Yes.
Does it mean that different types of the parasite cause different types of malaria, or like tell me about it?
Okay, we have the one that is most common here. We have Plasmodium falciparum.
Okay.
Yes, so we have different parasites. We have Plasmodium malariae. So each of the parasites it causes malaria, and then but there are ones that cause severe form of malaria, and then there are ones that can cause malaria that would. The malaria parasite will be trapped in the liver, and then they will be released subsequently. So the severity of the malaria also depending on the parasite. And then we have the ones that are predominant here in Nigeria.
Okay.
Yes.
All right. So I really want to understand, the way it works. When you say you have one that will cause severe malaria, tell me, like, are there types? Because if there's severe, then there's maybe medium or mild. How does it work? So we know how to, handle it sometimes.
Okay. From the symptoms, severity of the symptoms, right? We have mild, moderate to severe.
Okay.
And then we can also classify it as complicated and uncomplicated malaria.
Okay.
So the severe form of malaria, they are actually life-threatening conditions. And we see them more. They can happen to everybody, but we see them more in some particular group of people. Okay. Like in the children, in the pregnant women.
Oh.
So these are life-threatening conditions, and they have high morbidity and high mortality rates.
Oh.
So complicated malaria, or in severe malaria, yes, complicated malaria. It's not just the normal malaria that you have fever, you have chills and rigors, and then you take tablets, and then patient gets better. It has high burden of the parasites, and then it has affected other parts of the body. We can have cerebral malaria in children. We can have that affecting the brain, where you see a child convulsing, having seizure, and even loss of consciousness in severe cases.
Wow.
Yes, we can have anemia. That's the blood level of the patient, because I told you these malaria parasites infect red blood cells and destroy them. Yeah. So they can lead to person coming down with very, very low blood, and all the sequel of events that happens as a result of anemia, that's what we call low level of blood in patient, will be seen classically. Okay. And it's very, very dangerous and severe condition that needs appropriate intervention. Okay. It can also lead to yellowish discoloration of the eye. It can lead to the enlargement of the spleen, which is an internal organ. Oh. It can also lead to organ dysfunction and even kidney failures in severe cases, where patient has to undergo dialysis.
Wow.
Yes, that's to tell you the range of what it can happen. And then it can also lead to hospital admissions with blood transfusion, putting patient on oxygen in the intensive care unit. So you can see how the malaria can be very, very severe. Something that is absolutely preventable. When you put things in place, you prevent coming down with the malaria, but you can see the sequel of events that happen if it goes unprevented, and it's allowed to have its full have its full picture.
All right.
Yes, it's full biology. You can see what happens in complicated malaria. Then the other group also that's important. Okay. In pregnant women, we are dealing with two people here, and then pregnancy is a very, very delicate condition, right?
Yeah.
So the developing fetus, or the developing baby, let me use the baby,
okay,
is at risk, and then the mother is at risk.
Yeah.
It can these parasites can be transmitted from the mother to the child through the placenta. We can have what is called placenta malaria. It can lead to condition like low birth weight in the baby. It can lead to, and then when there is low birth weight, there are chances that the baby has to be in the special care baby unit with all the sequel of events that are associated with low birth weight. And then it can lead to premature birth. Still, the baby would come out before the time with low birth weight, with lack of development of some vital organs. Baby would end up being in the neonatal intensive care unit for critical care. It can also, for the maternal side now, it can also lead to preterm contractions. If it is not even handled properly, she can have miscarriage. Yes, and it can lead to the mother coming down with anemia and then coming down with also the severity of the malaria that would need specific and appropriate interventions.
Okay.
So you can see how if left untreated or if poorly treated, it can transform and progress from uncomplicated to complicated malaria.
Okay, thank you. Before we go to probably talking about prevention, there's a question that, has been brewing in my mind, and I'm sure it's a question a lot of Nigerians would, want to know. Sometimes when you go to the hospital and then you take a malaria test, you hear, oh, you have malaria 1+, 2+.
Okay.
So what does that mean? Does that speak to the severity of the malaria, or what does that really mean?
Okay. So once you go to the hospital and then from your result, the doctor interprets that 1+ of malaria, 2+ is of malaria. And let me break it down to how we will be able to understand without using so much technical terms, right?
Yeah.
So the gold standard in the diagnosis of malaria, we have 2 modalities.
Okay.
We have the rapid diagnostic test that will tell you, yes, there is malaria.
Okay.
And then we have the gold standard, that's the microscopy, where the blood will be taken and a blood film will be made, a smear and all that. Okay. And then the laboratory scientists will check and identify the particular type of the plasmodium, that's the causative agent. Okay. It will give you, because you view it directly under the microscope, right? And then it will be able to count each parasite per high power field. There is the way they classify it.
Okay.
So the number of parasites counted, there is a range between 1+, 2+, 3+, 4+. Yes, the higher the number of pluses, the higher the parasitemia, that's the burden of the parasitic infection in there. Do you understand? So the modalities of treatment also differs, because you can see the higher the parasite burden, the more severe the symptoms would become, and then the more chances it is to become complicated malaria.
Oh, wow. Right.
So when you hear +1, +2, it's actually from what they so identified and counted, and then the burden of the parasite that particular patient or person or client is harboring. So that's the interpretation.
Okay, so most times you have malaria and then they just give you treatment. So I think it's important that we understood.
Yes, what informs which kind of treatment. Yes.
All right, thank you. Now we'll go on a very short break.
Okay, thank you.
Now we take a very short break. When we come back, the conversation on malaria continues. Please stay with us.
Everybody has a stake in making the world a better place with love and compassion. As we thrive daily, we continue to strive to face the many challenges that faces our Earth, because together we all matter. On one side, we are exploring the captivating stories, the trends, the glamour, while on the other hand, we're looking at the love, the care and compassion from our champions. In our Stars Quiet Cove lies the burning passion for humanity, which is seldom known and unsung to the world. Join me on Famed to look at the flip side of your favorite beyond the regular.
Thank you so much for staying tuned. We're talking about malaria right here in the studio with Dr. Bala. All right, now we've been talking about malaria, and I must say my eyes have been opened, to a lot of things.
You're having more insight about.
Yes. So let's talk about preventive measures. Here, you sleep inside the mosquito nets. That's the basic thing they tell you. Tell us about really how we can prevent malaria.
Okay, thank you very much. Yeah. So the prevention of malaria is very, very important. As we know, prevention is better and cheaper and easier than cure.
Yeah.
And then from the public health sphere, and then even from the clinical medicine, we advocate more now about prevention. Let the disease not happen, so that you won't have to treat, and then you won't have to deal with complications, and then you won't need to be managing morbidities and then mortalities and disabilities that can result from complications.
Doctor, sorry to interrupt you.
Yes.
You've mentioned morbidity like twice now. So what do you mean by morbidity and mortality?
So what I mean that morbidity and mortality, like the burden of the disease.
Okay.
we can say is the morbidity, like it can lead to morbidity, the morbidity of the disease. And mortality is death that results from the disease. Then the morbidity, anything that has to do with the disease, including the disability that will come from the disease and everything. So we can say that morbidity, and then the mortality is the death that result from the disease.
Okay.
So you can see, as I explained earlier on, how the malaria, if left untreated now, can lead to morbidity and then the mortality. So the diseased condition, the condition of the disease, the clinical symptoms, and then the effect of the disease on the body, complications and all that, you can just sum it up as the morbidity.
Oh, yes. Okay. So we're talking of prevention.
Yes. So prevention now, we have to generally 4 classes of the prevention.
Okay.
We have the primordial prevention, we have the primary prevention, we have the secondary prevention, and then we have the tertiary prevention.
Okay.
So I'll briefly run through each, because each is very, very important.
Okay.
So for the primordial prevention, which is very, very important, this level of prevention is critical in that it prevents the causative agent of the disease, the transmission, or any factor that leads to coming down with the disease. It prevents it from happening. Okay. Do you understand? Okay. So in this now, we try to eliminate having the parasite itself. We try to eliminate having what even help in the breeding of the parasite and its transmission.
Okay.
So in the primordial prevention now, we try as much as possible to ensure that there is good and proper drainage systems.
Okay.
Because it's highly linked now. The breeding grounds of the malaria itself, we have stagnant waters in our environment, and then our climate also, like the environmental factors. Nigeria is among the temperate region. Do you understand?
Yes.
In tropical regions, right?
Yeah.
So we have high humidity.
Yes.
We have high heat.
Yes.
And then we also have bushy environment, and then we have stagnant waters after the rainy season. So these are natural factors that enable the transmission of the parasite. So in the primordial control now, we try as much as possible to eliminate all these things. So by ensuring that there is proper drainage systems to prevent stagnation of water, we ensure that there's proper environmental sanitation, where we won't see objects that can collect water littered around our environment, which are often sites within the urban and rural areas. You will see tires lying down there, you will see empty cans of things, where the mosquito, they will accumulate water, especially during the rainy season, and then the breeding of the mosquito continues. You see puddles of water uncleared, you see bushes. All these are breeding grounds for that specific female Anopheles mosquito to breed and then to propagate. And then you see drainages, improper sewage disposal. So if we have proper town planning, urban planning, if we have proper housing planning, and then if we have policies that would ensure, because people are mostly not compliant with environmental sanitation. So if we have policies that would ensure compliance to environmental sanitation, it would eliminate the possibility of having the breeding ground for the malaria, and then the elimination of also the transmission of the malaria. So that's the primordial level, where everything that will even bring the risk of having the parasite and its transmission is eliminated.
Interesting. But that's for the primordial.
So for the primary level of prevention now, there is a risk factor. There is malaria. There is mosquito. There is parasite in the mosquito. Plasmodium is there, and then the malaria mosquito is there. Female Anopheles mosquito. But what would you do to prevent you from getting the mosquito bite, right? And then to prevent you getting infected with the disease. So this is where our long-lasting insecticide-treated nets are there at home. It's supposed to be available for everybody from the primary healthcare, and then periodic distributions and all that, right? Then we also use a residual spray for people that afford it, that normal insecticide spray within the house. And then we also use mosquito repellents cream. We have different mosquito repellent creams. And then in specific conditions also, we do intermittent preventive therapy. As I mentioned earlier, this is done in in pregnant women, where they use sulfadexine pyrimethamine. That's fancida that they give them during antenatal care. So it's to prevent the malaria from happening, so that we won't be dealing with complications of malaria that we discussed earlier in the pregnant women, affecting both the mother and child. So intermittent preventive therapy is given at specific times during the course of the pregnancy. So that one is also part of the primary prevention. And then we have seasonal malaria chemoprophylaxis that is done with particular brand of anti-malaria given in places, because in Nigeria now the distribution of the malaria is not equal. There are places that have high prevalence of the malaria, and then there are places with moderate and then low prevalence of the malaria.
Okay.
So this is targeted to the places that have high prevalence of the malaria, where they give children, because I told you the severity of malaria in children and pregnant women is high. So they target the population at risk, and then it's administered to them, and then it's free. They give it in northwestern states like Kebbi State, Zamfara State, Sokoto State, and then Jigawa State, and then some parts of Bauchi, and Gombe also, they distribute that to prevent the children coming down with malaria, so that we won't have to deal with the severe form of the malaria. So this is for the prevention, primary prevention. Then for the secondary level of prevention, this includes it involves the early detection of the malaria, and then the prompt treatment of the malaria. So that you won't have to be dealing with complications of the malaria and mortalities resulting from this complication. So in this you treat the disease early, right? As appropriate, depending on whether it's mild, moderate, or severe at presentation. So you do appropriate laboratory diagnosis is very, very important here. Not to do tests and then you do poorly treated malaria and all that, and then it would result to complications. No, you start the treatment as appropriate according to as I told you, how you come up with the diagnosis, history, examination, and then the laboratory diagnosis, the gold standard to check the microscopy and see. So after doing that, now you treat as appropriate. So what our baseline treatment, our treatment here in Nigeria still is the artemisinin-based combination therapy. Which we have different of them. We have artemether-lumefantrine, we have dihydroartemisinin piperacin, we have artesunate amiodarquine. So these ones are different combination of anti-malarials that are used appropriately to treat malaria. And then in severe cases, we have the injection of the artesunate that we give. So here in the secondary prevention now, it involves the use of this early initiation of this treatment according to which line of treatment based on which type of malaria you are dealing with, so that the patient will not come down with mortality, and then would also not come down with complication resulting from the severity of the symptoms. So that's for the secondary prevention. Then for the tertiary prevention, after all this happened, you try to do rehabilitation, and then you prevent mortalities that could result from the complications that already happened, because that's the lowest level of prevention. So you can see we are coming from the topmost to prevent it from happening, to prevent the infection, and then to do early treatment. So if without doing all that, and then the patient maybe present at the last stage, late presentation, due to some challenges maybe, so that you have to institute also the tertiary level of preventing, managing the disabilities that could result from there, then rehabilitation of the patient and all that. Because when there is severe malaria now, different organs will be involved, and it would affect the patient. So when we have cerebral malaria, it can lead to patient having seizures, convulsions, and all that. So in some cases now, patient might need rehabilitation afterwards, after the complications that result. So you also prevent mortalities that would happen from the complications. As I mentioned earlier now, let's say the patient has multiple organ dysfunction, and then the kidneys are affected, acute kidney injury. So you do dialysis to prevent death from this kidney injury that the patient is having. So all these are forms of the tertiary level of prevention.
Wow, that's quite a lot. Thank you so much for that breakdown. But another thing I would like us to briefly talk about is the fact that actually we've been trying to deal and control malaria in this part of the world for quite some time. But coming from a public health, perspective, what do you think is the reason why we're still dealing with it? And do you think we could ever get to a point where we'll be certified maybe malaria free?
Yes, we are working towards that at all levels, from the clinical level, from the public health perspective. There are different programs put in place to encourage that. So, but it's multifactorial, as I mentioned. It's a multifactorial issue, right? So we are still battling with malaria, because we have, as I mentioned earlier on, Nigeria, the climatic condition now, it's very, very favorable for the breeding and then the propagation of these parasites. It's hot. these hot temperate regions and then humidity. These are all enabling this thing. They are all enabling for the growth of this and transmission of this parasite. So that's the biological component. And then we also have the environmental factors, right? Which I mentioned earlier on. Abundance of stagnant waters, bushy areas, and improper sewage disposal, poor environmental conditions that would lead to having different objects that can be breeding grounds for this mosquito. And then we have also overcrowded population in slums, and then in part of some urban areas where there is high density of people, and then population is highly dense population of people. Transmission definitely would be easier. We are sleeping like 5 of us in a room, crowded, and then one person gets malaria, and then mosquito gets to bite all of us in there. You can see how the transmission is because of overcrowding. So that too is also an issue. The other issue now is health-seeking behavior of the people.
Okay.
We have self-medication. People confuse all forms of fever to malaria. There is a difference. Fever is not malaria, and malaria is not fever. Somebody can have a fever as a symptom of malaria, but not all fever is malaria, and they start popping up medications. So people tend to treat malaria without treatment, without appropriate investigation. So some of the treatment now would be under treatment, and then some would just be like using the drugs indiscriminately. And then, so without lack of adequate investigation before commencement of treatment is very, very challenging. And then it's among the key reasons that we are still having this issue of malaria being recurrent due to poorly treated malaria and all. And then self-medication also, as I mentioned, and then people not even coming to the hospital at all due to some challenges. We have hard to reach communities. We have rural communities. You understand? We have communities that have access to basic health care. So in those kind of communities, you can see the full malaria getting from uncomplicated into its full-blown life cycle to when it becomes complicated malaria, because they don't have access to even the basic healthcare, to when the malaria is even mild until it becomes very, very severe. And then we have the asymptomatic carriers, because we are in malaria endemic region. So some people have malaria without knowing, and they keep going about with it, and then the mosquito keeps feeding on them and then transmitting it to the other people. So these are among the things that, among the factors that leads to us having the persistence of malaria. But as I said earlier, we have different programs in place, and efforts are being made to see that Nigeria one day will be declared malaria free. And then we have the malaria vaccinations also available. So this will go a long way in helping curbing the menace of malaria.
How available are the vaccines?
So it started around 2 to 3 years back. They introduced them. We have them now in African countries, Ghana, Malawi, Sierra Leone, and then we also Burkina Faso, and we have them in some states also in Nigeria. But now it's for children less than 3 years. Yes, and then among the malaria places that have high prevalence of malaria. So that's where we have them. But hopefully it would go around. Yes, the nation completely.
Okay, you mentioned something, and I just want to get clarity on it. You said you have mosquito. Some people have mosquito. They have malaria, but then they are not aware, and then mosquitoes keep feeding on them, and then they keep transmitting. Does that mean malaria is actually transmittable?
Yes, it's
like it's what do they call these classes of diseases?
It's transmittable because it has a vector. It's a vector-borne disease. So a vector has to transmit it from one place to another. You understand? The parasite is in there in the infected person. That's the Plasmodium parasite that we run through them. So it takes a vector to feed on Mr. A or Miss A and then transmit it to the second person. So it's not everybody that has malaria that comes down with severe symptoms. So some people are carriers of the malaria. Yes, they have the malaria in their blood, and whichever mosquito feeds on them will be able to transmit that malaria they are harboring, even though they are not symptomatic or having any symptom, and it will transmit it to person B, which may come down with the full-blown symptoms of the malaria.
So whether the mosquito is the female...
No, it has to be the female Anopheles mosquito for the life cycle of the Plasmodium to be complete.
Okay, I get it now.
Because there is one that happens within the stomach of the mosquito and within the digestive system of the mosquito and then within the body of the mosquito. So it takes the female Anopheles mosquito, because we have different types of mosquito, but specifically it's the female Anopheles mosquito that transmits the Plasmodium parasite.
Okay. I think this is quite a show. I've understood a lot. But then, as we're rounding up, because malaria is very common here, a lot of people have misconceptions about what really malaria is. And I'm sure you've come across some of them.
Very, very well.
Could you share a bit with us and, correct such misconceptions?
Okay. So among the misconceptions we see regularly is people coming to the hospital to say that they were exposed to the sun and their body got hot. So they got malaria from exposing themselves to sunlight. And then, as I said also, people tend to use fever, interchange malaria and fever.
Okay.
Once there is any febrile condition, they will come and say they have malaria. So it's not every fever that is malaria. And then malaria and typhoid are not interchangeable, because people will come to the hospital and say, I even treated malaria with antibiotics, because they said malaria and typhoid happen at the same time. They are transmitted differently, they are caused by different causative agents, and they are not interchangeable, and they must not happen simultaneously.
Okay.
So malaria is caused by parasite that is transmitted by female Anopheles mosquito.
Yeah.
So we have the environmental factor that leads to this transmission, and we try as much as possible to explain from prevention to appropriate cure and all that. And then other people think that clean waters do not transmit malaria, it's only dirty water.
Oh, so clean waters do.
Stagnant water, wherever it is, whether clean or not, it's a breeding site for malaria. So don't think that because we are keeping these containers, but we are keeping this. No, that's not the swimming pools and all that. They are treated and then they are being in use, so it will not be stagnant completely. Mark the word stagnant water.
Okay.
So we are keeping these tires and all that, but it's fresh rain that is falling. It's not gutter water and all that. So it's not that the dirt is what's attracting the mosquito. It's the stagnation of the water being the breeding ground of the mosquito also. And then clearing of bush also. Patients tend to they find it difficult to correlate between bushy environment and getting the malaria. So it's very important also to tell them that yes, it's the environment enables the vector to grow and then propagate. So which in essence leads to the more propagation of and transmission of the malaria.
Wow, Doctor, thank you so much. It's been an amazing conversation. Thank you for breaking down malaria. I'm sure a lot of people have better understanding now.
Thank you very much for having me.
All right. And this is where we draw the curtains on today's episode of Untangle. I bet you have learned something new about malaria. Ensure you go out there and you make use of the information you've gotten here to keep yourself secured from having malaria. And if you cannot do that, you heard what the doctor said, you go to the hospital and ensure you get the right form of diagnosis. Until we come your way again, my name is Blessing Dagin. Bye for now.